Okay. Well, hello, everybody. Welcome to the Healthy Joints, Healthy Lifestyle Show. My name is Dr. Rinola Dada, for those who don't know me, and I help people with joint pain become pain-free and people with autoimmune disease get their immune system back on track. So today I have quite the guest. Now, this is Dr. Hokehe Echo, and she is a phenomenal doctor. She's a board certified pediatrician. She is a TEDx speaker on ADHD. She graduated from University of North Carolina with a bachelor's degree in psychology, completed her master's in public health from University of South Florida, and then she graduated from St. John's University School of Medicine and completed a pediatrics residency from St. Joseph's Children's Hospital in New Jersey. She's completed additional training in brain health, which is the benefit that we're going to get from today's meeting, pediatric integrated medicine, and child abuse. So, Dr. Echo, thank you so much for taking the time for coming on the show today. I'm excited. Tell us a little bit more about why you do what you do.
First of all, Dr. Dada, thank you so much for having me. It's my pleasure to be here. And yes, so more about me, what do I do? I'm an integrative pediatrician and I specialize in taking care of children with ADHD and autism specifically because I found that that population of kids are often overlooked. And so I wanted to be able to help them partner with the parents to look at the kids from the inside out. So all the extra things going on with the children that feed into the behaviors that we see, right? And that's what I do. I address those concerns that the parents have.
Wow. How do we, it's so difficult. And I think almost everybody listening either has a child or knows of a niece, nephew. I mean, I have a nephew, my besties, one of my besties' sons, and I see the struggle. I mean, they're a very strong and supportive family, but what's the role that the pediatrician can play in kind of helping the parents and just this big extended family that wants to love this child? What's the role? How does the pediatrician help?
Yes, so that's an important question. So it's important to first of all have a pediatrician that you feel that you can talk to, right? And that will listen to the concerns that you have and that will be willing to go to bat for you because it takes a lot of advocacy, a lot of times, even in the school setting, even to advocate for your children to get the support that they need. But also from the pediatrician's end is also sending out those referrals that your child needs on time to like the different therapies like speech therapy, occupational therapy, and just providing a safety net. So it's important to find someone that will listen to your concerns and that will you feel like will help you. And yes, as a pediatrician, it's critical that because we are the link between the parents, the child, the school, and everything else that's going on in the child's life, the therapies. And so it's very important that we as pediatricians recognize our role and that the parents also recognize the pediatrician's role in getting the help and support that they need for their children.
Yeah. It's so difficult, right, for parents, right? I remember a good friend, and funny, I was kind of a go-between. I have two friends who don't know each other at all, and they both have children kind of dealing with things kind of in the autistic world, right? And I think one may have a little more difficulty than the other, but I would take lessons from one and say, well, this person is doing this and she's working with a social worker, and during the summer they're not taking vacations because they're doing speech therapy. And so it's like, but there's no good guidelines out there, to even know, because sometimes the school is telling her that, oh, your son's doing fine, right? And doesn't really say, hey, you need this extra help with speech therapy. So I don't know if that's where your pediatrician comes into, or, how do people know what they should be doing? Like, she didn't know. I just happened to have a friend who was dealing, like, well, this person down here is doing speech therapy in the summer.
Right.
You need to do speech therapy in the summer, but nobody told her.
Right. Oh, yes. So that's a really important question. Thank you for asking that question. So your child has been diagnosed with autism, and now what, right? In what direction do you go? Yes, it's absolutely critical that your pediatrician is someone who will lay it out for you. So I'll just say like some general steps. So if your child, a lot of children with autism and ADHD may have some speech delay, right, involved. And just for the parents who may get diagnosed really early, if your child is 18 months and up, you can receive a diagnosis of autism, right? So it's important that you ask your pediatrician for a speech therapy referral, and it has to usually come from your pediatrician to
Okay.
go to the speech therapy. But what I often tell parents is call around, because I don't know if my state is like other states, but in my state, there's such a wait list for everything, right? So call around to the few. um, I give parents like a list of occupational therapy, speech therapists, ABA therapy, which stands for Applied Behavior Analysis Therapy. That's a specific behavior therapy for children with autism. So I say, here's a list. Call these people, right? Ask them if you can get your child on the wait list, and then tell your pediatrician who to send referrals to, because sometimes there can be a delay in that process between referrals sent, phone calls being made to parents, and time is going. And as a pediatrician, I'm always stressing first 5 years of life, or as early as possible, we can get this diagnosis in. We need to get the children into therapy, because if we're going to make any changes with the child, the earlier we do it, the better. The first 5 years of life is the most rapid growth of the brain. And that's a critical period for any intervention we're going to do for children. So yes, parents, if you just received the diagnosis and your child isn't speaking at par for other children their age, you want to consider speech therapy. If you watch your child and they don't hold the pencil well, or they don't hold the fork well to eat, that could be an indication that there's some fine motor delays going on, which is really common in children with autism. You want to ask for an occupational therapy referral. If you're and or physical therapy. If your child is a really picky eater and doesn't like to try new foods, and seems like there's some textures they won't touch, some textures they will, that can be resolved with speech therapy. Speech pathologists are trained to help children with textures. So and sometimes if you don't ask for it, they may not necessarily say they do it, right? So if you're going to see a speech therapist and your child also has issues with feeding, you want to bring that up to your speech therapist and say, hey, can you please work on textures with my child? And then your child will get that service as well. So those are the major ones. And then ABA therapy referral has to come through your pediatrician as well. So yes, pediatrician is very important. Like one you talk to, and that will help you. And so there's in-home care and there's in-center care. And so it just depends on where you are with your life, but that you find those resources and you call them, because if there's a wait list, you want to get and as many as possible, and then have your pediatrician send referrals. So that will help. Those are the major therapies, right? That usually you will be trying to put your child in once they get a diagnosis.
Yes. So let's go back to kind of what you said, which really resonates. You're saying that in the first 5 years of life, you have rapid brain growth. And so I heard you say, emphasize a couple of times that, hey, the sooner we get the child the help and attention they need, the more likely that we're going to be successful. So question is, how soon is soon? Like how early can one even make that diagnosis?
Okay, so for the child that you're concerned about for autism, at 18 months, every pediatrician is supposed to screen a child for autism.
Yeah.
And after that, depending on how they do on that screen, then the pediatrician is supposed to send a referral to get the child evaluated. So that's like someone like me. I do evaluations for children with autism and ADHD,
Yeah.
in addition to caring for them. So from 18 months, your child can actually get a formal diagnosis of autism. With ADHD, it's typically not till they're 6, because with ADHD, we want to make sure the behaviors are the same at school and at home. So we wait till school age to give the diagnosis. I mean, if you saw a psychiatrist, maybe they would give you a diagnosis before 6, but typically pediatricians don't do it before the age of 6, just because we want to make sure it's not a one-sided behavior, right? And it's happening both at home and at school. So.
Yeah. But this is actually very helpful. So, the issue, right, is a lot of parents have not had years of experience on parenting, right? And so it's really hard to know what's happening to John or David. And we always have this thing that boys are slower than girls. So even if you've had girls and the boys, he's not doing the things that Sibs were doing at X age. I think having just an increased awareness of making sure that, well, he's not just deciding to be picky or he's just doing a boy thing, because most parents are inexperienced, right? Because there's a short time to be a parent, right? So you don't really get a lot of years of experience to really be able to identify. So, I mean, you kind of mentioned a little bit, hey, if he's not eating or if he's any other hints for kind of new parents to kind of say, hey, these are like, if you see this kind of, I mean, my world, we have like alarm symptoms. If you have this like 5 things or something, then definitely you're not waiting, you're seeing your pediatrician to really get more, to really discuss.
Right. Yes. First of all, I'll tell parents, trust your gut. Parents often know there's something off with my child. I was talking to a mom yesterday of a 16-year-old who hadn't gotten diagnosed until now. And she was saying she knew when he was a baby because he wouldn't look her in the eye while she was breastfeeding him. Like she wouldn't even make eye contact at all as that young. And so she figured something was off. So first of all, I'm going to say, don't disregard your intuition. If you feel something is not off with your child, ask for help until somebody takes it seriously and looks at it. And yes, there are some kids that don't show any signs of anything until after the first year, right?
Yeah.
And so let's go back. So under the first year of life, things that you would be watching for is your child isn't meeting milestones like every other child. So they're not sitting at 6 months, give or take, right? They're not babbling. They are not when you call them, they don't respond to their name. When you're interacting with them, they may not look at you or they just seem to be in their own world. Those are some things that you could notice before the age of 1. Other things we look for after that, after the age of 1, okay, their walking is delayed. So children, we typically give them till about 15 months for them to walk before we say, oh, there's a problem. Or if your child was speaking before and now suddenly stops speaking, that's a regression of a milestone, and you want to bring that up to your pediatrician like as soon as possible, because that shouldn't happen. So things like that, like they were walking, they stopped walking, they were talking, they stopped talking, or they continue not to want to interact with people, or when they hear loud noises, they seem more startled than you would think a child should be. And just those are the kinds of things I would watch for and bring up to your pediatrician, and just make sure you're keeping on track with your regular appointments, because your pediatrician sees your kid for 10 minutes, 15 minutes, if you're lucky, right? But you are the one with your child at all times. And so it's important again to bring this up. Doctor, I'm concerned about this. Can we please keep a close eye on it? And and there's a part where, I mean, between 18 months and 2 years of age, there's no visit. If there's things that concern you in there, by all means, make an appointment and go talk to your doctor.
I think that is so important, though, that parents have to realize that, yes, you're going to go and see the doctor, but your doctor may not have as much time with the patients. And so if you're not asking questions that kind of give the doctor an insight or a window into what you're experiencing, that may be a missed opportunity. A lot of us are going in to see doctors. A lot of people are going in to see doctors with a little amount of trepidation, right? You kind of know in your gut that all is not well, even adults. And then you go into that visit hoping that the doctor would find it. And like, okay, it's fine, because we're coming from a place of fear, right? Rather than from a place of curiosity okay, I suspect this. let me get some answers, what can be done. So that's really helpful. I think another jog to us that, you're only seeing your doctor for a few minutes. So if you don't present that full picture, we may not be able to get the help that we need to help our kids.
Yes.
Brain boosting. How do we boost the brain? How can parents help boost the brain function in their kids?
Yes. And if it's okay with you, before I answer this question, I wanted to go back to what something we just talked about a lot of parents, especially of their younger kids, may not want to believe what they see is happening and may feel afraid. And I often tell parents, your child is not the diagnosis. The fact that we have to give your child a diagnosis, it's only because we're trying to give your child support. Your child is not defined by the diagnosis. There are children with autism that are their gift. I mean, every child has a gift. And I always tell parents, just find the gift that's in your child. So for parents who, even culturally, it's like, I don't want to go get a diagnosis because it's like stigmatized. I'm appealing to you to move past that because it's so important for your child to get the help they need early. So, and now to answer your question about brain boosting. So you asked, how do we boost our brains, right? So I love to talk about the brain because I had a brain story, right? I was a junior in college and I was told that I had 2 car accidents 6 months apart, and I was told that I would never go to medical school by the neuropsychologist that saw me. And that, to say I was heartbroken was an understatement because I wanted to be a pediatrician since I was 5. But I proceeded to fail out of college because I believed what he said, right? But my parents were like, nope, you're going right back to college. Nigerian parents, like, that is not happening. You are a doctor. It doesn't matter what he said. Who's he anyways? So anyways, I did that. And so that's why I love to talk about the brain, because I know that we are not stuck with the brains we have. And I find that we often don't talk about the organ itself. How do we care for the organ, the brain itself? And that's really my message, is when we fall in love with the health of our organ, the brain, that we all do better. Like, our whole entire body does better because our brains run us, right? So the question is, how can we do that? Because if we look at it from that lens, if I'm going to drink something that I know will hurt my brain, I'll be less likely to do it, right? Because everybody, even the tiniest kid, when I tell them, do you want your brain to feel better? They all say yes. Everybody wants their brain to feel better. So if you're going to drink, let's say you're going to drink your 5th cup of coffee, and you've heard somebody say that too much coffee is going to narrow the blood vessels to your brain, then maybe you're going to put that cup of coffee down. And you've also heard that your brain needs the most water in the body of all the organs, then you're going to most likely want to drink the water, right? Right, exactly. Because your brain desperately needs the water to function, and we all want our brains to function. So it's just turning all the usual health messages, but from the angle of, is my brain like this or not? Am I being good to my brain or not? And I find that it works for both adults and children, because then they're like, let's take, let me step back here. I know what sugar does to my brain. Maybe I'm going to eat blueberries instead. So like I taught my 5-year-old, blueberries are God's candy. So now she wants to eat blueberries, all she can, right? Because there's no candy at home. But so she eats candy, she eats blueberries instead. And so, but she'll be the first to tell you, blueberries make my brain feel good, right? So that's simply my message, is that we fall in love with the health of our brains, because thankfully we're not stuck with the brains we have, and we can improve it. So.
Wow, that is so helpful. Even I'm motivated.
Please keep drinking, keep drinking. Yeah.
Okay, that was really helpful. Sleep is a big issue, right? It's a big issue with kids with either ADHD or autism, right? And so, can you share some strategies that can help?
Yes. So yes, you're absolutely right. Sleep is critical, because ADHD could also be called a sleep disorder. If the kids don't sleep, they will be hyperactive. It doesn't even matter if they have ADHD actually or not. So some things I tell parents, first of all, is making sure you have a sleep routine down. Like, and set it up in such a way that the child comes to expect that that's what happens. Lots of research has shown like that the blue light from Wi-Fi devices like your TV, your iPads, the phones, all of those things decrease the production of melatonin in your brain. Melatonin is what the brain secretes to help keep our sleep on target, like our circadian rhythm. And so think about it. If your TV is stopping your brain from producing what it needs to help you sleep, then we need to take out the TV, right? Because and we need to take out the iPads from the room and the phones from the room because that's counterintuitive and we're not helping, right? So instead, I ask parents, can you put the devices outside? And besides, we want to teach our kids that the bedroom is for sleeping, not for watching TV, because that helps them as they grow up. We want them to understand the boundaries between like rest and work or play, because those teenagers that you leave with the phones in the rooms, they're going to be on the phone all night, and then they can't function in school the next day. Then it just goes downhill from there. So that's one. And the other thing is so taking out the devices, getting the routines down. Something that helps I give to most of my patients is magnesium, because so much research shows that kids with ADHD and autism are deficient in magnesium, but magnesium helps with sleep. So I often, that's my first to go to for sleep and not a medication, because often the medications we give for sleep, yeah, are not the best we could do. So magnesium helps with sleep. It helps nourish the brain cells, and you're already deficient in it. So that helps the children sleep better. And I'll tell you a quick story. I had a 4-year-old boy. Mom came to me saying he's hyperactive. Can I get a diagnosis of ADHD? And of course I said no, because I'm not going to do that. But while she was there, I did a full integrative evaluation of the child, meaning I looked at all his systems and so she said, well, he doesn't sleep well. And then I said, tell me about sleep routine. And then it turns out the child is drinking chocolate milk in the middle of the night, is constipated, often has tummy aches, doesn't sleep, is hyperactive. Like you see there's a cycle there already. So I said, okay, so stop the chocolate milk at night. First of all, he doesn't need to be drinking at night. He's 4. He doesn't need it, like he's not a newborn or a toddler or younger kid. And then make changes in what he's eating and help with, we worked on his constipation. And I saw her like 6 weeks later and the kid is no longer hyperactive. I'm like, oh, so what happened? Oh, well, he no longer drinks chocolate milk at night. Constipation is better. He's sleeping all night now, and in the daytime, he's fine. But you see, if I didn't ask those questions, I'd have been tempted to meet somebody who would give him ADHD meds at 4.
Of course. Yeah. Wow, that's quite, yeah. So kind of, yeah, that is, and that really kind of goes to kind of looking at the patient as a whole, and having the buy-in of the parents to participate so that we have a good outcome for those kids. Okay. Do you have any others? That's actually a pretty good story. I like that. Any other kind of words of wisdom? You know, I think we kind of just touched the surface of kind of the lives of families who are trying to kind of help navigate through the process, right?
Right. So yes, I always start with parents. You are the best parents for your children. The fact that you're seeking help means you're an excellent parent for your child, right? And to know that there is hope, because often when they hear the diagnosis, it's like, that's it. All my dreams and hopes for my precious kid are out the window. And that's not true, because your child can improve, your child can get better. And I always tell parents, just take some time and see what the gift is. I mean, I've seen kids that I've diagnosed, but they hear a song one time and they can play the song, or they see a picture one time and they can paint it. That's a gift. And you want to do what you can to boost that, right? If it means music lessons, whatever it is. But I often tell parents, let's look for that, because every child has something that we can boost, right? And yes, we may have to change our expectations of who our child is and all of that. But again, the diagnosis doesn't define your child. Your child can be our goal, my goal, parents' goals should be that our child will be the best version of themselves, where they are, who they are, right? Regardless of what the diagnosis is. And so just to encourage parents that you're not alone on this journey, and there is support and there is help. Yes.
Yeah, wow. Well, thank you, Dr. Eko. So Dr. Eko has a TEDx talk, which is titled "We Must Change the Way We Treat Children's ADHD." And it's a phenomenal talk. I will really recommend everyone, because I think we all are affected in some way. We either know someone, have some family member or best friend's kids or somebody in our circle is dealing with this, right? So, I think this is a beautifully done talk by Dr. Eko. So definitely a must listen to. Again, it's called "We Must Change the Way We Treat Children's ADHD." So, Dr. Eko, thank you so very much for coming to the show. Can you tell us, how do people work with you?
Yes, thank you for that. So, right, I have a practice called Glow Pediatrics. And right now, we can do autism and ADHD evaluations in the state of Oklahoma, Maryland, and Georgia. And more states coming. But in those three, because there's a long wait list for children, again, going back to, we need to get kids in early so we can get the support they need. And then in addition, I provide ongoing integrative care for children with ADHD and autism. And I can see parents from anywhere, literally. Really. So best way to contact us is to go to glowpediatrics.com/contact and fill out our contact form, and we'll reach out to you. Or our office number is 405-871-5807, and we'll be sure to help you.
Okay, well, thank you so much. So for everyone, thank you for watching the Healthy Joints, Healthy Lifestyle show. So if you think this video has been helpful at all, like it, subscribe to our channel, Healthy Joints, Healthy Life, share it with anyone that you know that you think would benefit from it. Thank you, everybody, and thank you, Dr. Eko.
Thank you. It was a pleasure. Bye, everyone.
Bye.